My name is Sonal Chandalia. I'm the Chief Nutritionist and Diabetes Educator at Dr. Chandalia's Diabetes Endocrine Nutrition Management and Research Center. Today, I would like to discuss reversal of diabetes. Now, when we consider any person in your family or yourself, if you have type 1 diabetes, you may find that you heard a lot of people saying it's reversible, but that could only be a very temporary, short duration reversal. Remember that in type 1 diabetes, it may not be a complete reversal at all, and you should not get misled into trying to treat your diabetes by not using insulin. It is sometimes mandatory and required for survival when you have type 1 diabetes. Otherwise, there are chances of losing a life. So please be cautioned about the same, and you should make sure that this is treated very seriously. Now, as far as type 2 diabetes goes, it can sometimes be indefinitely reversed for a couple of years, but that is not a lifelong guarantee. The disease may return and may again be reversed again. So it can be something that is an ongoing process. But occasionally when you find a lifelong reversal, we find that this is where people claim that it is and term it as a cure. So diabetes per se as a complete, the umbrella of diabetes cannot be just cured, or there is no cure for it, but it is these selective situations and cases and profiles where it may work to be a lifelong reversal, and hence the word cure may be used. So both reversal and cure may be achieved or sustained by these lifestyle strategies, and sometimes only with a single medication, and hence people tend to call it a cure. So I would advise that when you have type 2 diabetes and somebody says they will cure it, it's not necessary that your particular case may fall in that category of it being a cure. Now, which type 2 diabetes can be reversed? We need to know that. So there is a condition called pre-diabetes. We may find that 5 to 10% of people with pre-diabetes may convert to becoming diabetic annually, but these conversion rates may vary due to the population, the characteristic of the population, and sometimes 70% of individuals with pre-diabetes may eventually get diabetes according to the ADA expert panel. But we can make sure that there is least conversion by giving education, and mainly lifestyle education, and that may help to reduce the rate of conversion of pre-diabetes to diabetes. So if there's a family history of diabetes, please always make sure that your profile is checked, so that if you are on the borderline of pre-diabetes, it will help you to take in some of these strategies to ensure that you don't convert to becoming a diabetic. Now, there may be some type 2 diabetes mellitus which is associated also with some moderate or severe obesity. Now, you may find a reversal here in the scenario that the person who has obesity, even if they lose about 5 to 10% of their present body weight, their parameters improve. And you may find that the diabetes also tends to reduce or become milder or almost go away. So it is 2-2 with the weight loss, and which greater than 7%. Then you find that these lifestyle modifications help with the exercise and the diet, and that may help to achieve this situation. Now, sometimes also additionally in gestational diabetes, the diabetes may occur first during pregnancy and then may go away after delivery. When we have known that more than 50% or half of them do convert to becoming type 2 diabetics after their delivery. So in the initial phase only, if we address it, then we will not have this conversion either. So if you know any individual in the family or yourself are in this situation, kindly make sure that you check your profile, meet a diabetologist, and ensure that if there is a pre-diabetes or the diabetes is there in pregnancy, you get it attended to so you don't become a person with type 2 diabetes. Now, there are some situations in diabetes which are maybe drug-induced, where steroids are used, where oral contraceptives are used, anti-cancer drugs are used, or antipsychotic drugs are used, and these may also lend to raising the blood glucose levels and hence convert a person to having diabetes. Now, in that scenario, or they're withdrawn from the system, and then lifestyle intervention may be applied, you may find that there is some reversal that you will see. Even there is something called stress diabetes, which happens when sometimes there is a certain acute illness that a person may be suffering from, and because of that they develop the condition of type 2 diabetes. Even this may reverse once their medical condition is improved. So it will completely depend on what your particular medical condition is with diabetes, and once that is looked into correctly, please beware of any false reversals or claims of false reversals, and you must always make sure that you check your liver and kidney function, because in the process of trying to reverse, it might lead to certain other damage. So how does one reverse diabetes? That is a particular strategy that can be used in a particular individual. One is by weight control. If the weight control is good, your glycemic control also will not worsen, or you may not become a full-fledged diabetic, and you'll be able to postpone that particular period and continue without having diabetes over a longer period of time. And basically, you'll be able to control your weight also, which will help a lot of other parameters. Then in the case of gestational diabetes, as we mentioned, where you may not convert into a type 2 diabetic post delivery, also by maintaining and making sure that you do the lifestyle intervention. Third is many times in a flatbush kind of diabetes, where you find that there are certain type 2 who may be ketosis prone. So those also, the reversal is possible. So if you're experiencing any of these situations, you must meet your diabetologist and healthcare professional to understand how it might help you to prevent and help to not convert into being a type 2 diabetic. Then also low calorie diet, because usually a slightly lower intake of food will help you also not exceed the calories or exceed the sugars or carbohydrate, and help you prevent and keep that reversal continued. Another option is to do it by exercise. Exercise is a very important component of lifestyle and goes hand in hand along with diet. And therefore, if the exercise is good, you find that the muscles, the uptake of the glucose through the glucose transporters, as we call them, the uptake is better, glucose is utilized better. And so exercise effect definitely helps in keeping your sugars down and also improving other profiles, and overall helps in reversal. Then it also can be through yoga, where we've seen through a huge multicentric study for those who are pre-diabetes or an IGTT group, that then standard lifestyle is used, or yoga is used, or methi powder is used. The yoga arm, people less converting from IGTT, that is the pre-diabetes, to diabetes. So yoga is also a very strong tool that can be used for prevention and helping in reversal, because you are kind of stemming the whole cascade of things that are going to come, and instead you're preventing it and you're letting your body stay in the correct glycemic control and not go into hyperglycemia and develop full-fledged diabetes. So another situation is as depending on the use of medication. So we find that when there is reversal of diabetes, sometimes a small dose of metformin or pioglitazone or an acarbose, which may help in keeping it in control, and therefore you will find that it will not further develop into and worsen the diabetes, but remain in that reversal stage for probably longer. So these are all the different strategies and maneuvers that can be used, which go hand in hand, and they can help in certain cases, in certain situations, and depending on that particular what your profile is. So definitely it should be looked into as an option first, before a full-fledged diabetes management treatment is started. If you fall in this particular category, then well and good, you put all your efforts in it, you will be able to bring about that slight reversal of diabetes and continue that for a little longer period of time. So one must not go blindly into thinking that it can for reversal or for cure. One needs to understand that if you fall in the particular category and it is workable, then it can be worked in, and one may be able to get that kind of treatment for reversal. So please be cautioned that it should not be done blindly, but should be understood and then undertaken.